How does a CORT scan diagnose stroke? Have you ever wondered how doctors quickly determine if someone is having a stroke? One of the key tools they use is a computed tomography scan, commonly known as a CORT scan. This imaging technique is crucial for diagnosing strokes because it provides detailed images of the brain, allowing healthcare professionals to see abnormalities in brain tissue and blood vessels. When a stroke occurs, it can either be ischemic or hemorrhagic. An ischemic stroke happens when a blood clot blocks blood flow to the brain. In contrast, a hemorrhagic stroke is caused by bleeding in the brain. A CORT scan is particularly effective at distinguishing between these two types of strokes. This distinction is vital because the treatment for each type is very different. For instance, clot-dissolving therapies used for ischemic strokes can be harmful if given during a hemorrhagic stroke. When a stroke strikes, the affected brain tissue undergoes changes. These include swelling and a loss of normal density due to cell injury. A CORT scan can typically reveal these changes within 6 to 8 hours after symptoms begin. Additionally, the scan can help identify other conditions that might mimic stroke symptoms, such as brain tumors or structural abnormalities. This ability to rule out alternative diagnoses is crucial for effective treatment. In addition to standard non-contrast CORT scans, there are specialized techniques that enhance stroke diagnosis. One of these is CORT angiography, where a contrast dye is injected into a vein. This allows doctors to visualize the major arteries supplying the brain and neck, helping to detect blockages or abnormalities in blood vessels. This information is essential for deciding on interventions like clot removal. Another advanced technique is CORT perfusion imaging. This method assesses blood flow at the capillary level within brain tissue. It helps identify areas where brain tissue is at risk but may still be salvageable. This information is especially useful when patients present several hours after stroke onset, guiding treatment decisions. CORT scans are often the first imaging test performed in suspected stroke cases. They are widely available, fast, and effective at excluding hemorrhage. However, it is important to note that early ischemic changes may not always be visible immediately after symptoms begin. Some areas of the brain, like the brainstem or cerebellum, can be more challenging to evaluate with a CORT scan. In such cases, additional imaging, such as magnetic resonance imaging, may be necessary. Overall, CORT scanning plays a critical role in the rapid diagnosis and management of stroke. It helps differentiate between stroke types, identify vessel blockages, assess tissue viability, and exclude other causes of neurological symptoms. This timely and accurate diagnosis enables healthcare providers to deliver appropriate treatment, ultimately reducing disability and improving outcomes for stroke patients. Always remember, if you or someone you know is experiencing stroke symptoms, it is essential to seek immediate medical attention.